Good evening, good afternoon, everyone. I hope you guys are all doing well from wherever you are. And thank you for joining us for this session. So, this is going to be one of our industry discussion forums. Confirm for me if you guys can hear me perfectly well. Thumbs up for whatever you're doing on your end. Thumbs up if you can hear me using the reactions. Thank you, Lisa. Thank you, Anita, as well. Perfect. Good. So as we get started, this industry discussion forum is mostly looking at how do we unlock Africa's production potential for pharmaceuticals in the pharma industry. And some of the key challenges that will be discussed today will be around market fragmentation, procurement challenges, and also any other barrier that we're looking at that would actually impede the ability of the industry to address these challenges, but also ensure there's reliable access to safe, effective, and quality medicines. At the starting point of views, we have to acknowledge that health is a fundamental human right. And to achieve that right, we need to ensure that medicines are available for those who need them. The question is, what are the barriers to that? And in this context, we already know there are two that are flagged off, and we'll have an industry expert and seasoned entrepreneur and professional as well, who will be taking us about what are the challenges that they observe from the industry engagements, but also what opportunities do we have to unlock that value. And one of our hopes and aspirations as African Pharmaceutical Network is to be able to move from pointing out where the problems are, but to be able to work with each other and collaboratively design solutions, design interventions. And these interventions are towards guaranteeing that every single patient, anywhere, wherever they are able to get the right quality medicines. And we'll talk about these as we move through the conversations. So for this particular moment, what I would want to have us get into is just to have kind of some ground rules. And I'll be sharing my screen just now. And sharing some ground rules for us. So in this conversation, as we are starting it off, we're going to have only 4 main ground rules. One, this is an industry discussion forum, but it also serves as our networking opportunities. You work from whichever part of the world, probably you are doing any work that is interesting that you think you need to have partners and allies and collaborators within the continent. This is your opportunity. How do you take advantage of it? Introduce yourself in the chat box. Everybody has access to the chat box for networking purposes. You name which country you're coming from, what do you do, and also best case scenario for continuing conversation, share your LinkedIn account link so that somebody can connect with you, can follow up on that conversation, whatever it is that you think might be of interest and areas of collaboration. That's number one. Two, your microphones and cameras are turned off or muted in respectively, mostly to avoid distractions. At the point of the Q&A session, we'll be able to allow people to raise questions and concerns as we move through the conversation. So take note of that. And if you have any questions, please note them down so that you don't forget. If you have any other questions, even during the conversation, to help you not forget, we have the Q&A tab at the top of your screen or whichever device that you're using. And that Q&A tab will be monitored. I have my colleague on the side, Juliet, will be helping me with the moderation and actually following up on that. I would urge you to post that question as early as possible so that we don't miss it out. But it also gives us a guide in terms of how does the conversation move forward and what insight do we expect from Emmanuel through his experience, but also through his presentation and the work that he's doing. So with that, I'll take a pause here and welcome Gift Shareka, who is the Secretary General, former chairperson of the Pharmaceutical Society of Zimbabwe, to give an overview of what Pharmaceutical Society of Zimbabwe does and the work that he's leading there. Then we can go to the next part. So over to you, Gift.
Thanks, David, and thanks to your team for organizing this webinar. So we'll just take you through on what Pharmaceutical Society is, since we are also co-hosting. I hope everybody can see my slides.
Yes, we can see it, and we can hear you perfectly well.
Perfect. Okay, so we are a professional association of pharmacists registered in Zimbabwe, and our members are those pharmacists who duly consider the objects of the Pharmaceutical Society of Zimbabwe, of course, after having gone through the current constitution and fully appreciating their constitutional requirements. And just a brief overview on our governance. We represent all pharmacists in all our geographical areas in Zim. with 10 voting members who sit in what you call the council. And the voting members constitute 6 elected by the branches. And we've got 3 national members and a member who is seconded by the Pharmacists Council of Zimbabwe, which is our registration board for all pharmacists to practice. And of course, we also have non-voting members who sit on our PSZ Council, representing other key relevant industry stakeholders. Either you're a board member for that stakeholder, and you represent Pharmaceutical Society as a board member for the stakeholder, or you are actually invited as a representative of that key stakeholder to come and present certain issues to council. So that's our council, and the executive has got the president, the vice president, secretary, treasurer, and our immediate past president. And the current president is Vimbai Mkakati. She'll be joining soon. Our vice president is Mr. Mnyarazi Maunge, and our secretary is Mr. Bukhe Dube, and our treasurer is Ms. Tembi Dubiwa, and I'm the past president. In terms of our objects, we enable our pharmacists to join together in a constructive effort to promote the work of the profession. And we encourage and foster goodwill amongst pharmacists and allied professions to improve the science and art of pharmacy by spreading scientific knowledge among pharmacists and allied professions. And of course, we are against malpractice, and we recommend our members to uphold the recognized standards of the profession. We do have professional standards that we adhere to, and we're constantly updating these and maintaining them, and we keep them aligned with the Code of Ethics, and the guidance of the Code of Ethics is always prescribed by our registration board from our Pharmacists Council of Zimbabwe, and also our local Medicines Control Authority of Zimbabwe. We also ensure that our workforce development is aligned with global standards. So we ensure that the training of our pre-reg pharmacists, the pharmacy students, and the pharmacy technician trainees is adequately done according to international standards. And we're already participating in the ongoing surveys and information collection with other collaborators like FIP and Commonwealth Pharmaceutical Association. The workforce development framework is robust enough, and our institutions are in adherence with those frameworks. In terms of our network, of course, our motherboard will be the local Ministry of Health and Childcare. They develop the National Health Strategy, which is reviewed periodically. Sometimes it spans 5 to 10 years, and with the National Health Strategy, we then use that to guide how us as a society can contribute and achieve and accomplish the goals that are prescribed by the ministry. And within the society, our key stakeholders include, but not limited to, the Community Pharmacists Association. These are mainly our retailers, the Pharmaceutical Manufacturers Association, our industry, our manufacturing industry, the Pharmaceutical Wholesalers Association, who are the distributors, and the schools of pharmacy, where our pharmacists are trained. We've got 2 in Zim at the moment, University of Zimbabwe and Harare Institute of Technology. We also have students represented in our activities through the Zimbabwe Pharmacy Students Association. And we've got pharmacists who are actually helping us in dealing with the common challenge with youth of today, which is drug abuse. So we've got an entity called Pharmacists Against Drug Abuse, helping us in that regard. And of course, our regulator, which has done quite so well in terms of the WHO maturity status, and we are proud of them regulating us to ensure that we provide safe, effective medicines to our populations. And our registration board, the Pharmacists Council of Zimbabwe, we're working together. And we also interact with the College of Primary Care Physicians of Zimbabwe to ensure that our contributions to the public health framework remains relevant, and there is cohesion with other key stakeholders, especially the primary care physicians. And we do also interact with other networks that I left out, like the College of Public Health Physicians, nurses, to ensure that our strategy is in sync with what we intend to achieve as a nation. And regionally, we are a member of the African Pharmaceutical Forum, and of course, with our newly established network with the African Pharmaceutical Network. Thanks for coordinating that, David and Tim. And globally, we are a member of the Commonwealth Pharmaceutical Association, taking part in the workforce development that I mentioned, lots of CPD programs that are coming through to ensure that we maintain best practices within the pharmacy profession locally, and also participating in the initiatives, antimicrobial stewardship. There's some work that is coming on the horizon, and we shall be taking leadership on that. And we are also a member of the International Pharmaceutical Federation, the FIP, where we are actively participating at council level and other initiatives that foster the profession. So that's us, David and Tim. I can take comments, questions. Thank you.
Thank you so much, Gift. Thank you for a brief overview in terms of what you guys do at Pharmaceutical Society of Zimbabwe. And one of the key things that I really appreciate in terms of what you've shared is the breadth of the network and the engagements that you have from a local level, regional, and continental and the global level. Because at the end of the day, the patients count on each of us in our different domains. And the question is, what can we bring to the fore? How can we foster these collaborations in service of the community? So I hope for all of those who are here, please let's take advantage of these opportunities, engage and see how can you contribute to PSZ. But also, how can you gain from what PSZ is doing in delivering on the mission that we all have? So I'll bring up my screen and I'll give you an overview of what we do as African Pharmaceutical Network. And the essence of this is to be able to establish and know what do we do as an organization on our end. So African Pharmaceutical Network started operations in 2020. That was specifically at the point when COVID was taking charge of the world and actually disrupting most of operations. And when we did that, our main guiding principle was to ensure that we can foster collaboration in networks. And that links to the network that I was talking about. How do we bring professionals, stakeholders, and the different organizations working within the ecosystem, including governments, to drive missions towards ensuring reliable access to safe, effective, and quality medicines? And one of the key things that we noted is that to be able to do that, we need a common platform and a common voice that is bringing people together. And this is one of those kind of opportunities and initiatives that we say African Pharmaceutical Network can bring professional associations, can bring industry associations. And therefore, then we have a joint conversation where we're saying, your pain points can be my pain points, because if they inhibit my ability to access medicines at the hospital, there is a pain point somewhere, and we need to work together to address it. And our key focus is on knowledge sharing and this capacity building, workforce development, policy shaping, but most importantly, fostering partnership. And that is why I mentioned, please share your details on the chat so that you can connect with people, they get to know what you're doing and where you're doing it. Why is this important? As a continent, we have different challenges, and people have talked about it in different ways, and some of these conversations will also come in Emmanuel's presentation. We have limited local manufacturing capacity, and when you talk about manufacturing, don't talk about last mile, the finished pharmaceutical product. Look at it from the excipients, the raw material that we're dealing with in the production, the active pharmaceutical ingredient, across the chain to the last product that actually is now getting to patient being used. There's limited local manufacturing. Somebody needs to invest in that. But the only way we will invest is when we know where the problem is, we know the levers of control that we have within our scope, and we're able to work towards making that a reality. And so far, for a long time, we've been all working in our silos, and therefore there's an opportunity to come together. And our aim was to build that common platform that bring all stakeholders together to shape that vision and that mission that we're looking at. What guides us every other day is to ensure there's reliable access to safe, effective, and quality medicines in Africa. And the only way we can do that is by investing in the key enablers and support ecosystem that we want to achieve. This is inspired by a set of values, and our core value that I would mention here is humanity, because we believe before we become any other thing, we're human beings, and if we value humanity and the humanistic beliefs and values are within each of us, we will do the best, we will act with integrity, we'll be professional, and we'll deliver exemplary service. And in healthcare, by the virtue that we already took the Hippocratic oath as healthcare professionals and are committed to serving our patient needs, then humanity has to be at the foundation. And all that we do as African Pharmaceutical Network is to ask ourselves, is it the right thing? Did I respect the person? Did I see the human before seeing whatever value they can bring to me? And if that comes into perspective, then you will not affect the operation that we're dealing with. This has been the journey, and I would move it from a point when we started the vision in 2020, seeing all the interventions and how things were disjointed, but also coming together with the vision and saying, let's build it together. And at the moment, I would say we're doing some great improvements and great partnership that we're having, for example, with Pharmaceutical Society of Zimbabwe. And it is a journey towards making that vision and that future that we're hoping for a reality for all of us. What services and what work do we do? We have pharmaceutical workforce development under the Pharmacy Academy, and we offer training programs, especially professional development courses. At the moment, we have 3 of them. regulatory affairs, pharmacovigilance and patient safety, pharmaceutical supply chain management. Those are the key courses, and we're keen on developing more depending on what are the needs in the market. And the unique thing that I would want to mention there is we are not experts at an individual level, but we crowdsource expertise from the industry, people who are actually doing the work. And that then ensures that the training is not only theoretical, but also has the scientific rigor from a theoretical perspective, but has the practical nuance of somebody who is dealing with it on a day-to-day basis. Then we offer regulatory technical support services, business ecosystem support, including market research, intelligence, and all that, including talent linkages. And last piece is we work in an ecosystem. We work with governments. Policies and healthcare and pharmaceutical industry is super regulated, and we need to work with regulators, whether it's regulating practice or regulating the product. And every time we ask ourselves, what policies would make it not easy for the pharmaceutical industry to be able to operate in this market? And how do we remove those barriers? Or how do we work with the government to see the need to invest in enabling the pharmaceutical industry, but also professionals to practice in that ecosystem? So those are some of the critical things that we are working on. These are the courses that we currently have in scope, but we're still building on more, and we'd be keen to engage with you and to have you join us as some of our learners as we move on. How can you become engaged and get engaged with African Pharmaceutical Network? We have membership options, which is individual, but also institutional memberships. Individual membership, we understand they're students, we have professionals, and those are the different categories. For students, you'll have US $25, professionals $50 in terms of membership. Benefits, you have the training opportunities for all the training that we're having at discounted rates, access to professional networks and communities of practice, consulting opportunities and referrals when we have opportunities in the network, but also thought leadership to be able to share perspective on what's happening in the market and in the industry where you're working. For institutional members, we have African institutional members and international institutional members with the different rates. And the benefits of those membership is the market intelligence that we're able to curate and gather depending on where your needs and how do you need support in that space. Business linkages and facilitating of partnerships are a critical piece. We can't do everything on our own, and therefore we can work together with people who knows the right person who can deliver value for you. Business ecosystem support services, I already mentioned those in terms of their intelligence, market research, and related. Shaping policy and thought leadership in the industry. And those are some of the key development that we're having. These are some of the partners that we already have at the moment. We're still building on that, and there's extra space. So for those organizations who are here, individuals who are keen on bringing the organization and partnering with us or joining as members, we are eager to work with you and see how the next phase of our engagement could be to unlock value in Africa's pharmaceutical industry. What can I ask of you? You can become a member, partner with us on the projects that we're executing or any challenges that you're having you need help with, and learn with us and taking our courses. But most importantly for now, let's enjoy the learning and engage in this conversation that I'm going to introduce to you with Emmanuel taking us through what are his experiences, observations in the market. So with that said, we move to the next part, which is Emmanuel taking us through his work. Somebody would be asking, who is Emmanuel? So Emmanuel Mujuru is the chairperson, Federation of African Pharmaceutical Manufacturers Association, focusing on bringing together all the pharmaceutical manufacturers in the continent. And at the moment, we have more than 700 pharma manufacturers who are parts of PharmaMA, and they are represented either through their regional associations or in their individual capacities engaging with PharmaMA. He also doubles down as the Group Chief Executive Officer and founder of Plus 5 Pharmaceuticals, which is a private limited company based in Zimbabwe, with a mission and a commitment to develop Africa's pharmaceutical manufacturing industry, not only in Zimbabwe, but across Africa. And that is his mission. Before this, he's worked in different capacities and different levels. He served as a former president of the chairperson of the Pharmaceutical Society of Zimbabwe, that is the Pharmacy Council, as a board member as well. He's worked with the National Executive Committee member of the Zimbabwe and the National Council member of the Confederation of Zimbabwe Industries, president of the Mashonaland Chamber of Industries, council member of the Pharmaceutical Society, chairperson of the South African Generic Medicines Association. So he's a man who has done his work, but he's also keen on still continuing this engagement. And I believe we're going to learn a lot from him. And his commitment is in trying to see how does he shape the industry from a business, from a regulatory, and also from a professional standpoint by furthering education and investment in education for professionals. He has graduate qualifications in pharmacy and finance, but also postgraduate qualification in business administration and leadership. So with that said, I'll bring it back and actually invite you to be able to start off your session with us, Emmanuel.
All right. Thank you very much. And greetings to everyone in this forum. And it is a pleasure for you to invite me to join this meeting. And it is a meeting of colleagues. I'm also a pharmacist, so I'm in very familiar territory. And I feel very much at home. So thank you very much for inviting the Federation of African Pharmaceutical Manufacturers Association, PAPMA in brief. And we are a continental organization that has been around. We were formed in 2013 in Addis Ababa, and we chose Addis Ababa because it was the city of the African Commission. And as a continental body, we felt it opportune for us to be able to meet there. And this came out of a realization that is African pharmaceutical manufacturers, whether we're in the East, South, West, or even in Northern Africa, our challenges are the same, and we are all committed to the same objectives, which is the provision of quality, effective, and affordable medicines to the African continent. And it was also following the realization by the heads of state of Africa that the continent was highly dependent on the importation of medicines. So my presentation, I'm going to talk about the pharmaceutical market and also the potential for pharmaceutical production. And I'm also going to address the topics that I've been made to address or speak about, which is the fragmentation and procurement challenges, how it is the hindering growth and the competitiveness of the pharmaceutical industry. And I'm also going to talk about PAPMA. And I think we will be very much keen to also affiliate ourselves with the African Pharmaceutical Network, since we almost address the same objectives, although from a different perspective. So can we move to the next one? Just to give my address into context, COVID-19 pandemic exposed the fragility of our health systems and highlighted the necessity of our countries ensuring at least minimum level of security of health products. I think we also what happened, most countries faced with an epidemic of the COVID-19, which it was, they started practicing what was called vaccine or nationalism, where they will ensure that their people first have the essential supplies of vaccines and essential medicines before they could export them to other countries. And Africa, because of its high dependence on imported medicines, found itself in a very disadvantaged position. And it was a wake-up call for the continent. And I think now the question is, how do we stay awake? And someone has asked that question. What have we learned from the experience of COVID-19? And also I need to point out that governments globally, also in Africa, are thinking or actually developing local pharmaceutical sectors, even in developed countries that had apportioned the provision of medicines to other countries. They've started coming up with policies to establish manufacturing capacity for the essential medicines. It's happening all over in Europe, in America, and so forth. And the development of the African pharmaceutical industry is being limited by structural challenges, such as small and fragmented markets, logistical constraints, tariff and non-tariff barriers, and inadequate market information. Africa pharmaceutical production falls far short of local demand. On average, 30 to 40% of demand is produced locally. There are very diverse levels of manufacturing maturity among the African countries. We've got countries in Northern Africa, Egypt, for example, it is currently able to manufacture almost 91% of their medicines. And other countries like Algeria, Morocco, Tunisia, and so forth, manufacture almost more than 60%. In other countries, there's virtually no manufacturing taking place. And so it varies from country to country, but I'm looking at it from a continental perspective. On average, we can say 30 to 40% is being manufactured locally in Africa. And the inter-African exports are limited and they're very low. At most, Africa trades, almost 13% of total trade is between African states. And this is a major limitation in terms of promoting not only pharmaceutical production, but industrialization in Africa and also trade in Africa. You'd find that you can take example for a city in Zimbabwe, Harare, to Lusaka, the distance is less than 400 kilometers But you would find that, and it would take less than 24 hours, actually 6 hours to drive there. But you would find that there's virtually no trade that is taking place between Zambia and Zimbabwe. The same applies with other countries. And I think that is familiar with most African states. And there are examples that happens even in West Africa, where some countries in West Africa get their supplies from France or from Europe, while there is manufacturing capacity just across the border. So this is something that as FAPMA we're trying to address. And there's very strong upward potential for growth when it comes to both pharmaceutical production and industrialization in general. Sorry, next. FAPMA was formed, as I mentioned, in January 2013, when African manufacturers and regional associations got together and they realized the need for us to speak with one voice and to strengthen our advocacy for an enabling environment that promotes pharmaceutical production and allows our people to be able to produce medicines for themselves. And our vision is to be a vibrant and self-sustaining pharmaceutical manufacturing industry in Africa by providing quality and affordable medicines so as to contribute, I repeat, so as to contribute to the reduction of disease burden and also and promote economic development on the continent. And most importantly, also to improve the quality of life of our people. And we do that through collaboration between regional associations, manufacturing associations to address our common challenges which are faced by the industry and enhance opportunities towards self-sufficiency. And we achieve through advocacy and partnership with other stakeholders in promoting the production of quality, affordable medicines. And I think it's an opportunity for us, obviously, to work with APL in that regard as well. So let me just give a glance of what the African pharmaceutical market is. And because of lack of reliable information, the figures of the size of the African pharmaceutical market vary depending from which source you are getting the information from. I am quoting reliably from the Africa Development Bank, which come up with a figure of 27.43 billion, being the size of the African pharmaceutical market in 2024. And it was said to be growing at a compounded annual growth rate of 3.76%. And based on that growth rate, it is estimated to reach 38.24 billion by 2023. And I also need to point out that Africa imports 95% of its APIs. So there's virtually no production of active pharmaceutical ingredients. And it imports, on average, plus or minus 70% of finished product formulations from outside Africa. And there's been an increased focus to address this disparity, which puts Africa at a risk in terms of provision of health products. And we've seen that being addressed through the PMPA, which is the Pharmaceutical Manufacturing Plan for Africa, and also the business plan, which was also put in place to operationalize the PMPA. And also the regional economic commissions have also come up with their own regional growth strategy for the pharmaceutical industry. And we've also seen emphasis on regional harmonization and also continental harmonization as well through AMA, the African Medicines Agency, and also with the various regional harmonization programs like Zazibona in Southern Africa, and also West Africa and East Africa also have got equally effective harmonization programs that have been put in place. And there's an increasing prevalence of chronic and infectious diseases, NCDs, non-communicable diseases. We've seen an increase of 37% of deaths in sub-Saharan Africa in the past 10 years. And this is a wake-up call, up from 28% in 2013. And in 2023, Africa had 25.6 million people living with HIV/AIDS. And these people required continuous ARVs. And Africa itself is the major, it's got the highest prevalence of HIV/AIDS. And it is important that we have the capacity to be able to provide these essential medicines for our people. And we've also seen a rapid population growth, and Africa has got one of the fastest growing populations in the world. Population is almost 1.3 billion and going up, and the GDP of 3 trillion. So Africa, in terms of size as a continent, it compares quite favorably with countries like the US in terms of the GDP, India, China, and so forth. Next slide. And also the key drivers from an economic and also health perspective, the population I mentioned, the GDP, and also there's increased urbanization with 600 million people living in urban areas, and also 50% of households with the disposable income of more than $20 a day. And health expenditure has been going up, and is estimated at 200 billion. And also there's also the drivers coming from the public health perspective. There are also patent expiries, which creates an opportunity for the industry to be able to manufacture medicines that have just come out of patent. And also there's growth pandemics that I mentioned, HIV/AIDS, and an aging population. We've got 16 million people with hypertension, 1 million cases of cancer, 18.6 million people with diabetes, and there's also improved health insurance and coverage. So this has created market for consumption of medical products and pharmaceuticals in particular. And just to give you an overview of trends of the African pharmaceutical market. 27 billion, that's the market size. In Africa, spend in terms of pharmaceutical per capita per person is 6 times lower than the world. And basically what it means is that our people are at the lowest levels in terms of access to medicines and also the expenditure on medicines. And this is a key health indicator. And also 40% of sales are concentrated in Northern Africa, and East and West experience 4% growth. And also it's important to mention that the top 10 countries in Africa account for 75% of total market share. I've spoken about and addressed on the African markets and also the opportunities that is there, and the increased demand for biosimilars, vaccines, and oncology. And this is a growing market, but still very limited in Africa. So there's need to come up with innovative types of products, and including biosimilars and oncology products, in order to address the increasing health demand for the continent. And the epidemiological profile of the continent is moving towards a high share of non-communicable diseases and injuries. We're moving away from, before it was predominantly on infectious diseases. So we're now moving towards non-communicable diseases. And that creates a different burden in terms of the demand for health products compared to infectious diseases. And 50% is too polarized around communicable diseases, and the HIV/AIDS being the major, and respiratory infections and tuberculosis and so forth being also very key. And non-communicable diseases account for 45% of the continent diseases. And this obviously shows a clear epidemiological shift in terms of the profile for the continent. And the market fragmentation challenges. This is one of the major challenge of doing business in Africa, in the sense that we've got 52 countries, if not 54, including Seychelles and so forth. And each country has got its own regulatory systems. It's got its own requirements in terms of restrictions of medicines. So basically what it means is that before, if you wanted to market your products in Africa, you have to submit applications to the 54 countries and their regulatory authorities. And some of the countries are not big enough to be a viable market in terms of provision of medicines and manufacturing of medicines. And so that creates a big challenge. And what it also means that in terms of capacities of production, you're also disadvantaged in the sense that you're producing so small volumes, and where sometimes the labeling requirements means that you have to have customized labeling for each country. And that creates limited economies of scale and high production cost. And what it means is that unlike in big economies or in big countries with bigger populations like China or India, you can set up a manufacturing facility manufacturing even 1 or 2 products. In Africa, in most cases, you have to set up a facility that manufactures more than 20, even as high as 100 products. So this creates impacts on your production cost. And also the quality standards differ from country to country, depending on the strength of regulatory systems in that country. Some countries don't have any regulatory system to talk about and don't even register products. And some of those countries are obviously open to the influx of substandard and counterfeits, and that creates health risk as well. So next. Okay, diagnostic of the African. So given this scenario, it is important that we accurately diagnose what is the problem on the African continent and how do we come up with solutions to address these problems. So I just give you an overview in terms of the diagnostic profile of the Africa pharma industry. We've got 38 countries where there's some form of manufacturing taking place. This could be in the form of manufacturing common dosage forms like your liquids and ointments, and also in some countries there's also high-end manufacturing of specialized products like your oncology products and so forth. So this accounts for more than 30 to 40% of demand, and 80% is concentrated on 75% in 10 countries. So 60% that the average cost per unit observed in Africa compared to countries like China and India. And this comes from the economies of scale and other input costs that are familiar with the Africa pharmaceutical environment. There is low level of integration along the value chain with limited to no R&D, research and development, and API production taking place. So most of the 90% is just focusing on production of general products. Africa accounts for less than 2% of worldwide research and development or projects that are happening in Africa. And less than 20 manufacturers are producing APIs. Total production capacities are mostly focused towards manufacturing processes of generics and demand-driven therapeutics. And these are mostly 80 to 90% your solid oral dosage forms and your creams and liquid dosage forms. And more than 70% is dedicated towards generics. And these are just common law and generic products. And they are increased, and there are increased barriers that are faced by pharmaceutical manufacturers in Africa, and this is affecting their competitiveness and preventing the development of new actors. And we identify as a FAPMAT 6 main barriers that include the lack of supportive policies, market access, access to funding and regulatory systems capacities, skills development, higher manufacturing cost. And only 7 companies have achieved WHO pre-qualification. And it is important also to point out that 50% of manufacturers, most manufacturers in Africa are operating at capacity utilization of below 50%, which is quite surprising, but I'll address that in my presentation in later slides. So at the same time, where capacity utilization is very low, there's also very low production or by African manufacturers for the requirements of the African markets. And there are procurement challenges. I think we all are quite familiar in our different countries. For the manufacturers, there's limited access to affordable raw materials and APIs, active pharmaceutical ingredients. These are mostly imported from India and China. And if you add freight costs, and also some of the manufacturers of these APIs have also vertically integrated into production of finished products. So while we are also buying raw materials from them, we are also competing with them. And so that creates a competitive disadvantage on the market. And sometimes prices can be raised out of preventing competition. And there was also inefficient procurement processes and supply chains. I think we know the infrastructural challenges that are faced in Africa in terms of road networks and also rail and sea networks and so forth. In other countries, because of lack of sea freight, you'll find that it is cheaper to ship a consignment from China, which you can get in Beira in less than 2 weeks. While if you want to ship a consignment from Southern Africa to West Africa or to East Africa, it might take even 3 months by sea, and partly because of the lack of cargo that is transcending those different ports. And there's also limited visibility and predictability in demand forecasting. I think that's one area that we need to pay particular attention to. There's a lot of wastage that is happening in terms of expiry of medicines, even in the public health sector and in the private sector as well, where there's no accurate data to be able to accurately determine the consumption and demand levels. So in most cases, you're operating in darkness, and it's difficult to be able to accurately predict and plan to meet demand. And that results in wastages. And so happening in a continent with limited resources. There's something that I think as pharmaceutical experts and also colleagues and specialists, it's an area that we need to invest in. Accurate data is critical for planning. Thank you. But having said that, there is opportunities for growth. The African Continental Free Trade Area and regional integration. And this is out of the realization by governments and our leaders that we need to trade more with ourselves than we do with the outside world. And so there is now increased policy direction towards opening of borders, creating free trade areas, allowing the free movement of people, free movement of goods, free movement of commerce between African states. As I mentioned earlier, intra-Africa trade accounts for 13% of the total trade that Africa has with the rest of the world. So this, until and unless we are able to trade with ourselves, growth will be limited, and also we will not be able to realize our full potential. There is increased demand for pharmaceuticals, and there's opportunities for local manufacturing, and there are opportunities for local manufacturing to contribute to economic development, scientific development, and job creation. Pharmaceutical production and manufacturing is at the cutting edge of scientific development. If you're talking of research into new molecules, research into API production, and even the process of production itself demands application of up-to-date and scientific knowledge. And it is an industry that the scientists in Africa and the experts in Africa need to apply themselves in. And in most cases, there's a correlation between the density of or the concentration of engineers, chemists, pharmacists, various scientists with the development of the pharmaceutical industry. We saw it happening in India, where they were able to do that because of the availability of skilled people, chemical engineers who managed to do reverse engineering in manufacturing APIs and so forth. And there's also social benefits that come from production and the availability of pharmaceutical products, the reduction of disease burden, and the improvement of the quality of life being the key. Next. FAPMA has been involved and has been at the center in terms of pushing and advocating for the promotion of pharmaceutical production in Africa. We've been advocating and we've been at the center of playing an advisory capacity on various initiatives that have been taking place in harmonized regulatory frameworks and standards in Africa. And we've also been promoting through our engagement with the Pharmaceutical Manufacturing Plan for Africa to promote local manufacturing and industrialization. And we've worked with UNIDO, UNDP, Africa Union Commission, NEPAD in pushing that agenda. And we've also been involved in enhancing capacity building and training for our members. We have relationships with the USP, which came up with subsidized prizes for African manufacturers for analytical reference standards that we use in quality control and analysis of our products. And we've also been at the forefront driving market shaping policies to improve access, to improve market access. One of the key impediments to the development of the pharmaceutical industry in Africa is market access. In as much as there's demand for pharmaceutical products, but Africa is not buying from its manufacturers. Most of the supplies of medicines and health products to Africa are coming from outside Africa. And until we have got very strong demand, which then drives the growth of the industry, we have limited development of the pharmaceutical industry. And even the other health products like diagnostics and devices and so forth. And also we've been at the forefront fighting and engaging providers of finance to have finance access funds available for the manufacturers. So that's one of the major limitations that is also affecting the development of the industry in Africa, the access to finance. In other countries, there's no capacity to lend money to manufacturing. And it's an industry that is capital intensive, which needs a lot of money to set up. And if the money is available, in most cases, it is short term and at high interest rates. In Africa, in most countries, it's not unusual to hear of interest rates of above 20%, when globally the interest rates are plus or minus 5%. The need for policy harmonization between industrial development policy, public health, finance, and various policies that affect industrialization and also the provision and availability of health products. And also we are also in the forefront advocating for universal recognition of African regulatory standards and systems. The picture out there is that there are no regulated systems in Africa, and the quality and standards in Africa are generally very low, and that's what led to the requirement for WHO pre-qualification, which was then pushed by various donor programs, because they felt that the regulated systems in Africa are of such low standards that you cannot have reliable quality products being produced in Africa because of that. But with the coming in of the WHO global benchmarking tool, resulting in African regulatory agencies, authorities being able to achieve the ML3 and above, we as FAPMA are now pushing that as at minimum, ML3 should be recognized as equivalent to a stringent regulatory authority. And in that respect, any market authorization or any license being granted by ML3 regulatory authorities should qualify should be accepted by donor programs like UNICEF, Global Fund, as a minimum requirement for them to buy from any manufacturer who has achieved or been licensed by those authorities and has received marketing authorization from those authorities. So it's something that I think as Africans we really need to push for and be proud and have ownership of our quality standards and support various initiatives that are taking place to improve regulatory systems in Africa. Next slide. This is just an illustration of what we've been talking about. This is a slide that came from UNICEF and that look at their procurement of pharmaceuticals, which they are supplying in Africa and also the rest of the world. What you can see is that Southern Africa, for example, consumed 26% of medicine that were supplied of the total pharmaceuticals that were supplied by UNICEF. But if you look at the countries that are manufacturing those pharmaceutical products, there's Kenya, which managed to produce 5.7 million, and but otherwise, and that is almost for a quarter of almost 80 million. But otherwise, there's no African country or any African company to a great extent that is supplying medicines to UNICEF. And the important thing is, which is at the center of the mandate of FAPMA, and at the center of our advocacy initiatives, is also tied in to the strengthening of regulatory systems, is the requirement that we should get more and more manufacturers being able to be qualified in their quality standards recognized by UNICEF and among other donor procurement programs for them to be able to procure from those companies and also those countries. Next. And as FAPMA, these are FAPMA board members. We had a meeting with the Global Fund where we continuously engage them to open up and buy more from African manufacturers. Global Fund is a major supplier of drugs for pandemics, especially mostly HIV/AIDS, malaria, TB, among others, and also essential medicines for opportunistic infections that are linked to these pandemics. And our position and our advocates' position with regard to our engagement with the Global Fund is that we want them to recognize the ML3 as being qualifying for stringent regulatory authority status. And also, we also advocating that they should buy 30% of their requirements, of their supplies from African manufacturers. So it's a message that is gaining traction, and it's something that we are at the center of our advocacy. And it's also important to take note that at a meeting that took place between the Global Fund and also Ministers of Health from Nigeria and also South Africa, that message was really driven home. And there's now recognition at Global Fund that is something that needs to be addressed. And the question is now, how then should that gain traction? And how do we then put ourselves in a position that we can be able to demonstrate the necessary capacity and also being able to be in a position to take on that commitment. Next slide. There are 7 key barriers. These I'll talk to them, and I've also alluded to some of these in my earlier presentation. But if I can say that the 7 key barriers that are impacting on the competitiveness and preventing the development of pharmaceutical industry, market access to finance, policy incoherence, and high input cost. Here we're looking at cost of energy, In Africa, you'll find the cost of electricity is on average above 15 cents per kilowatt hour, while in countries like India, China, the cost is below 5 cents per kilowatt hour. So there's need to increase investment in energy, and also transport cost because of the infrastructure and the non-availability of cheaper forms of freight, rail, example, across African countries, means that we are forced to resort to high freight means of freighting our products, and sometimes we have to air freight our products and even air freight raw materials from outside Africa if we're going to get them quickly. And also in countries, sometimes you're forced to use air freight, because if you try to use, if you're in inland country and you try to use road and rail, it might take even months before you get the product. So this impacts on the cost of production and inadvertently on the cost of products that we produce in Africa. So if you are coming out with a policy, you have to recognize these input costs and these advantages that African manufacturers do face. And there's also weak logistics and infrastructure that I've mentioned and alluded to, and the need for regulatory harmonization to reduce the cost and open up markets so that you can create economies of scale. And skill shortages are also a major factor. In getting the relevant skills, yes, you can have the education and professional qualifications, but it takes a while to get the necessary skills to be a regulator scientist, to be an expert in production and quality assurance systems, and in other skills that are required in setting up an efficient and competent pharmaceutical manufacturing facility. Next. I put in there a picture of Africa and showing the various regions that are in Africa. The key regions is Southern Africa, Central Africa, and East Africa, and West Africa, and North Africa. This is important in strategic if you are trying to overcome the challenges of fragmentation and also that we're talking about. And you'd find that the regional economic groups have been formed around these regions. For example, in Southern Africa, you've got SADC, and in East Africa, you've got the East African Community, and Central Africa as well, and in West Africa, you've got ECOWAS, and in North Africa, you've got the Maghreb region. And all these regions are trying to come up with harmonized policies and also free trade areas to allow the movement of people, commerce, and trade among the countries. And this is out of the realization that you need economies of scale. You need big markets for you to be competitive. And also, to a great extent, the regulatory harmonization that has been taking place has been along those regions. And so what it means is that any strategic insight in terms of trying to address and ensure that we meet and we produce more in Africa for Africa, you have to recognize and leverage on the initiatives that are taking place at regional level, and eventually gravitate towards the continental markets. And there is movement towards through the African Continental Free Trade Area to create the a common market for Africa. And it is important then that strategic partnerships and collaborations also take place, taking into account the regional perspectives that are mentioned. And investment in technology and innovation requires a lot of capital. And for you to be able to do that, you should then be able to tap into the big markets that are being created at regional integration level. And there's need also to leverage on artificial intelligence more so in areas of focusing demand, be it at manufacturing level, but also at public health and at government level as well. Artificial intelligence is something that we should embrace and leverage on it to develop our industry and also be able to move forward. And I think what Africa had done, or one of the major achievements that happened in Africa, was the assimilation of mobile technology. Africa managed to skip the requirement to have, your old telephone systems, which it didn't have. That it embarrassed, it then was able to embrace mobile technology. And as a result, Africa has got one of the highest penetration of mobile technology. It is being used, the apps are being used to transfer money as payment platforms, transaction platforms. And I think we should do the same with regard to artificial intelligence. And there's no need for us to go back or reinvent the wheel. I think we should be able to ride the crest of the wave in terms of development that is happening at the technological front. And there's need for Africa to procure more of its products, pharmaceutical products, medical products, and there's also need to avail funding for development of the industry, startups, brownfield projects, greenfield projects, you name it, in various requirements. Next slide. This just looks at policy alignment that I was talking about. The national government policy alignment framework. We've got various ministries. There's Minister of Education, Minister of Science and Technology, Minister of Industry, and Minister of Health. And these are all players when it comes to the manufacture of pharmaceutical products and the provision of these products. So there's need for alignment between the policies by the various government ministries and departments as well. In some cases, there's what you call policy incoherence, where the various ministries are not talking to each other, the departments are not talking to each other, the left arm does not know what the right arm is doing, and as a result, there's conflict, and that affects and ensures that and result in no seamless development of industry. And education, you require the training of the right skills, the emphasis on STEM, and coming from the education policy, the science and technology policy, the industrial development policy, which most countries have got to usher the development of industry. And that also need to talk to the national and health policies. Because those products that are going to be produced through the effort of the industrial development policy should also find a market in the Ministry of Health. So those are some of the things that are important when it comes to the alignment of policies and the integration of government efforts towards production of health products. Next slide. This is the blueprint, what we call the blueprint for African pharma. This came out from the Pharmaceutical Manufacturing Plan for Africa, PMPA, and was adopted as the model that should be used to develop the industry. At the lowest bottom, which is the foundation, is political commitment. There has to be political commitment at government level to develop pharmaceutical industry. And then there has to be policy coherence, the alignment of policies that I was talking about. And there's also need for a sound sector development strategy. We've seen it happening in India, in China, in Brazil, and in other countries that were in a similar situation that Africa is in 2 or 3 decades ago. And the need for sound sector strategy need no emphasis. It is the glue that is used then to bring everyone together. And the pillars are your human resources development, and also there's a pillar to access to products and technology. The other pillar is access to affordable finance, and also the availability of incentives. And the other pillar is strengthening of regulatory systems and enforcement. And the other pillar is the partnership, collaboration, and the fostering of business linkages. And the other pillar is enhancing of market data and collections and facilitating market access. I need to emphasize again the importance of market data. As I mentioned initially in my introduction, you've got various figures when it comes to the size of the African pharmaceutical market. And those that come out with projections of how big it is, they are looking at it from different perspectives. So the non-availability of data is an impediment to the development of the industry, and also for anyone to be able to plow their limited finance or funds to setting up a facility. You need to know exactly how big is the market and what is the estimated demand, and so that you can plan and come out with an investment that is tailor-made to that particular demand. And having done all this, the foundation, the pillars, you can then come out with a that results in competitiveness, sustainability, and self-reliance. And above all, the icing on the cake is quality access, availability, affordability of quality medicines, and not only medicines, but we're talking of health products. So this is the blueprint, which has been the framework that has been used to develop the industry. Okay, next slide, thanks. Then the strategies that one needs to interrogate themselves and need to look at when you come to really how then do we ensure that Africa moves from 30 to 40% meeting demand of its products to the 80-90%, and also the 91% that countries like Egypt have achieved. So these strategies are aimed at overcoming fragmented markets and also the procurement challenges that I mentioned about. Regulatory harmonization need no emphasis. We need to create a harmonized regulatory environment covering regions, covering the whole continent, that will ensure that there is one point of call when you want to provide your medicines in Africa, which is recognized by the whole region, by all the countries, and by the entire continent. And this will eliminate unnecessary steps and accelerate drug approvals. And the Africa Medicines Agency was formed with that in mind. What we are calling for is FAPMA, is the operationalization of AMA, and it's something that we think is taking too long, and it's something that obviously we'll continue to engage with. The need for local and regional manufacturing, instead of just looking at countries, one has to look at manufacturing at continental level. There are certain, for example, products like vaccines, a plant can be able to produce for most of Africa, if not the whole continent. So when you are setting up a facility like that, you cannot be setting it up just for one country, but one has to look at the entire regional or continental market. And Africa as a continent has the same population similar to India and China. So by harmonizing, it means that we've got a market as big as China and India available for technological infrastructure and development. And it is important for us to do that if you are to be able to produce and reduce our reliance on imported medicines. And that is crucial for health securities. And we realize that when we're faced with the COVID epidemic, and we should be prepared in the event that we are faced with a similar epidemic. And not only that, but you've got situations where we have got neglected tropical diseases, where medicines for neglected tropical diseases are not being where our traditional suppliers or manufacturers are moving away from those products because by nature they are not as profitable as new designer drugs that are meant for their markets. And bearing in mind that Africa only accounts for less than 5% of the worldwide pharmaceutical market. So it's not lucrative it's not, I wouldn't say lucrative, but it's not a business case for someone outside Africa to set up a plant and or even invest in research and development in coming up with a new treatment for schistosomiasis, for example. It doesn't make sense. So this is a burden that as Africans we need to look at and see how we can be able to come up with the capacity to develop our own medicines and take into account the particular or peculiar disease patterns in Africa. Technology and automation. There's need to leverage technologies like blockchain, AI, and robotics to enhance supply chain transparency, track and trace systems, and improve manufacturing efficiencies. This can also reduce errors which are very costly, and they can also be used by regulatory systems and also manufacturers to control counterfeits and substandard products. And the need policy coherence, I've spoken about it, the need for alignment of public health, industrial development, trade policy, education and skills development policies, finance, economic policies, scientific development policies, and so forth. The alignment of those towards development of the industry and also giving the necessary support and creating the necessary ecosystem that is required to develop a viable industry. And there's need for strategic partnerships at country level, strategic partnerships between a country in West Africa with a country in North Africa and companies in North Africa. And we need to go beyond, transcend borders and build partnerships. And that is important, and share the various expertise. Even a distributor in North Africa distributing products from a manufacturer in West Africa or East Africa. Those are the partnerships that we're talking about. And it's important that we build those partnerships at continental level and realizing and recognizing the various skills and the competitive advantages that other countries have over others, and companies in other countries also have over other companies as well. The need for government support is crucial. Government is at the center in terms of driving development, economic development, scientific development, education, and so forth, and also provide incentives and that are required to support and create an enabling environment for manufacturing, and also investment in infrastructure and promoting local manufacturing. And the industrialization, promotion of industrialization is a deliberate thing. It's not something that is left to chance. It's a deliberate government effort to do that. And that's why we've got countries like China ahead of everybody. If you look at the way they do their things, everything is focused towards development of the Chinese manufacturing capacity. And as a result, you'd find that manufacturing in China accounts for more than 35%. It's as high as 45% of GDP. In African countries, manufacturing accounts for less than 5% and 10% in some instances. So it shows how far we are and the gap that we need to close. Next slide. In conclusion, unlocking Africa pharmaceutical production requires collective effort, as I have alluded to, and FAPMA is committed to driving growth and development in the industry, and collaboration and partnerships are key to success. Next slide. Call to action. What are we saying? Africa's pharmacists and stakeholders should support FAPMA's initiatives. Let's work as a team, and let's have support from APN, and let's have collaboration between FAPMA and APN And there should be collaborative efforts to promote local manufacturing and regulatory harmonization. This is key. Let's open up and strengthen our regulatory systems so that we produce and make available quality products for our people and protect our people from counterfeits and substandard products. And investment in Africa, pharmaceutical industry for a healthier future. There's need for us to invest in the industry for the health of our people. And we should advocate for policies and initiatives that foster a conducive business manufacturing environment, enhance regulatory harmonization, improve market access, and avail affordable long-term finance. And there's need to develop solutions for problems that uniquely impact the African continent and its pharmaceutical manufacturing industry by advancing and implementing policies which will support regional value chains and technology and secure supply chains across borders and ensure safe and uninterrupted flow of medicines. That goes without saying. The development of an industry, you need to have a supportive ecosystem for research and development. You need to have CROs, bioequivalent centers. You'll be surprised that there are very few centers, CROs in Africa that can offer clinical bioequivalent studies, which are crucial for research and development of formulations. And in most cases, we're forced to procure those services from outside Africa. And when available, given the different genetic makeup, genome between various ethnic groups, you might find that you might end up having medicines that will be tolerated by certain ethnic groups, not being tolerated by ethnic groups in Africa. So there's need to be able to, and moving towards like your biotechnology products and your biosimilars, your biopharmaceuticals, that is becoming even more and more demanding. And there's need for operationalize AMA, Africa Medicines Agency. It should have happened yesterday. It's something that is overdue. Next slide. Okay, thank you very much for your attention. It has been a pleasure. I hope I've managed to do justice to this very important topic. Thank you.
Thank you so much, Manuel, for that wonderful presentation and taking us through this. And I love the fact that you've left it at a point where we are looking at it from what can we do and where are we doing it. And I think critical things for us to ask ourselves, how do we bring these collaborations? How do we bring every other person into the fold? And most importantly, the question is, how do we drive the policy coherence? Because at the end of the day, unless we address solutions that are actually within the continent and get the business ecosystem that is needed for it, there is a pain point. And I would just mention some of the observations that I've seen in the last couple of years or so, like actually last 2 years. There's a lot of attention around regulatory system strengthening with focus on bioequivalence, and even some regulators mandating it as a requirement for industry, which is a commendable move. But then we need to ask ourselves, do we have the capability? Do we have the centers? And what does it take to bring the centers? So with that said, I'll head over to the Q&A. I already see there are a couple of questions that were sent here. So question number one, maybe I'll give you the question from Lawrence Kimani asking, I always ask the question, who determines what is manufactured in Africa and who determines what is imported into Africa from the global north? Is there any response that you could have on that? Who makes that determination of what should be manufactured here or not?
You want me to take that question or?
Yes, please.
Okay. Who determines what is manufactured in Africa?
Yes, and he's added another question linked to the same. The level of intra-Africa trade is minuscule, between 13 to 18%. Are there forces within and without the continent that predicate the level of trading among African nations?
Who determines?
Yes.
It's demand. The determination is demand, really. and the capacity to be able to produce those products. And demand is determined by the medical practitioners and the treatment guidelines and the treatment patterns that within that particular country or in that region or on the continent level. And I think the emphasis is always to prescribe effective and the most effective medicines available, and also take into account the cost as well. So as manufacturers, we react to demand. We don't determine what to manufacture. We react to demand. If there's a demand for a certain product, a certain molecule, then we go and invest in that. And obviously, you also have to have the capacity or the capability to be able to produce that product. For example, if you want to do oncology products, it basically means you have to have a specialized unit, and it's an investment that is in excess of $100 million and so forth. And so sometimes the capacity, that's why I spoke to all those variables, and that affects like availability of funding, markets, and so forth. And in terms of, I think the other question was, why is there low intra-African trade?
Intra-Africa trade.
Yeah, it's for the reasons that I mentioned. You'll be surprised that countries don't trade with each other for various reasons. And maybe it's because maybe the products are not available, and maybe because of the fact that I'm just thinking loudly. And but there are also structural challenges that are in place, infrastructure, for you to be able to. How accessible is your neighbor in terms of you sending products there, and also you know, the barriers that are there, trade, import duties, and so forth. So, but the good thing is that the Africa Continental Free Trade Area is a realization of the requirement to open up those borders, and there are policies that are being put in place. And I think the first draft of products, in excess of 200 products that are now under the Africa Continental Free Trade Area, and have been put in place, which products every African country should not put any restrictions in terms of the movement of those products. So it's something that is moving. Yeah, thank you.
No, thank you. Thank you for that. There's a question that Norman asked here. On a scale of 1 to 10, how would you rate the level of coherence in policy and government policies to stimulate local production in the continent?
1 to 10.
1 to 10?
Yeah, for at continental wide, I can put it at 4, but you got countries that are almost on 10.
Oh, okay.
Yeah.
Any examples you'd be glad to share?
Yeah, I give an example. I was in Egypt recently, and in most Northern African countries, the harmonization or the alignment of policies is admirable. It's admirable, and in most cases, it's actually pushed by it's a government and the head of state and national policy. So everyone has to be in line in terms of their respective ministries and departments in terms of aligning the policies at national level. Okay.
Fantastic. Thank you so much. I've already seen we're actually beyond our time for the session, but it's been a good conversation listening to you and learning from you. And maybe one question that I would ask, especially looking at it from a point of working with professionals and professional sessions, what are some of the key talent needs that you look at in the industry, and how can we bridge that gap? Especially when you look at skills, yes.
Yeah, the skills in quality systems.
Quality systems.
These are quality management systems, and so you need skills in terms of analysis and operation of advanced instruments, your HPLCs, your various instruments that we use, and you need skills in that respect. And also you also need skills in terms of coming out with systems, including pharmacovigilance systems, market surveillance, and also skills in research and development. Research and development. I mean, that's very crucial, and also engineering as well, design of facilities, equipment, and manufacturing systems, and HVAC systems, and water purification systems, and various equipment that we use, and so also in marketing as well, management skills as well is very important. You need marketeers who are able to understand the markets and determine demand, and logistics system, supply chain experts as well. You need skills in that. If you are going to move products between borders, and efficiencies in ensuring that there's no wastage, you reduce cost, those are very crucial skills. And now there's AI now, artificial intelligence. It's a new area, and the growth in the artificial intelligence is being projected at more than 26% annually, 26 to 40% annually. So it's something that is going to be with us in the few years, and by 2030, the whole landscape would have changed. Thank you.
Okay. Thank you for that. And maybe my question that this will be more linked to the work that we're doing, because we try to invest in skills development within the industry, especially in the regulatory sciences, pharmacovigilance, pharmaceutical supply chain management, which are the core of the work that we've been doing at the moment. From your end, in terms of what you're looking at in industry engagement, are there opportunities where industry can collaborate with us to make that a possibility? Because one of the key gaps most of our professionals have asked in terms of those industrial experiential learning beyond the training.
Yes, definitely. I mean, we at one time, I think there was a mapping that was done, and centers of excellence were sort of mapped out to say which one center will be able to offer certain skills. Partly because of the fact that some of our countries are very small, so you cannot have a center committing himself to a certain skill. So then you look at regional to say, okay, if we are going to train data scientists, for example, let's have a university in a certain country doing that. If we are going to have a regulatory scientist, then you have a certain university that specializes bioequivalence, clinical research, bioequivalence, and so forth. So it's something that, and for your information, we've also been talking to the Association for Universities and so forth, and to see how that collaboration can be enhanced. But in most cases, it is coming through third parties. It could be USP, it could be UNIDA, it could be UNDP, and various. It could be NEPAD and so forth. So there is a drive towards that. And what is important is the recognition that, and also the focus in terms of what sort of skills are required and how many are required, so that then investment can be done meaningfully. Otherwise, the importance of information is important. Why industry give its estimate in terms of the skills that they need and the number of professionals that they are able to be able to hire, and so that at the end of the day, there's demand is met and the specific requirements are addressed. Thank you.
Thank you so much. Thank you so much for that. I really appreciate the conversation and also the insight that you've shared. I'll reach out, and I'm definitely keen from African Pharmaceutical Network in seeing how we can partner with FAPMA to drive this mission together. So with that said, Juliet, I'll request that you bring for me the Menti so that we can have the poll. I'm requesting for maybe just 5 more minutes, team, so that we can go through the last part of this. Juliet, please help me bring up the Menti. For all of us who are in the group, let's go to menti.com. It's one of the feedback forms that we normally use. Just menti.com. I've shared the link in the group already. The code, yes. Then the code is the one that we have at the top of the screen. 5109 4384. Yes, 5109 4384. That is there is a Menti code for access to the specific poll that we're running. Join at menti.com, key in the code, and give us your feedback. I'm already seeing one person in the call. Menti.com, then key in the code 51094384. Just give us your feedback. Doesn't have to be a long statement, just the one key thing that you think you're taking away from this. Opportunities for improving pharmaceutical industry. Africa is making great strides towards improving local manufacturing and health product security. Thank you for the insights shared. Fantastic. Thank you. Chinese ML3. Okay. Pharma market is similar in size to the Chinese. ML3 should be pushed as an SRA. I think that is more in terms of the market size. We're talking about a population of 1 billion people in Africa. We have 1 billion plus in China, but also the same billion in India. So in terms of market size, we have the same number. The question is, how advanced are our industries? That is an opportunity to explore. Market research is critical for both pharma and biopharma industry, definitely. Many opportunities for pharma industry in Africa. We need to pick up the pace and improve on quality of products. Definitely agree with you. Learn about the challenges that African pharmaceutical manufacturers are facing and the attempts to address them. Good. Relevance of policies in promoting local manufacturing. Utilization of AI in the future for the pharmaceutical industry. And I'm hoping you'll work on that aspect on AI in pharmaceutical industry, especially with focus on Africa. That's an opportunity. Importance of SRA in regional harmonization. That is a regulatory component. Fantastic. Thank you. Anybody else? I want to give a minute, then we move to. I'm waiting for 2 more, then we move to the next one. Two more people. Menti.com 51094384. Investments in skills development. Fantastic. All economic regions should collaborate. Great. Thank you, the 2 people. Juliet, we can move to the next slide so that we clock within the next 2 minutes as I already promised.
Sorry, David, my network is hanging.
Oh, it's okay.
I'm bringing back the slides.
Okay.
Oops.
Can I see it now? Good. Let's get the other feedback, guys. Where's your feedback? Waiting for 4 more people. 4 more people, then we move to the next one so that we also kind of save on time, guys. Idiot, I think we can move. Anything that informed your score? As we go through that, maybe just announcements for the last of this. We will share the presentation materials with all of you on email. I believe all of us registered, so that will be coming in on your emails after this. We will also work on the certificates for each of you, especially for those who participated based on participation. So you'll get those. So Kenyans, please subscribe to the same on the Pharmacy and Poisons Board CPD portal, so that you'll get the points awarded to you on the portal. But on the other end, those who will have the certificate that will be shared, use it to be able to claim your professional development points from whichever health organization that you're working with in terms of the country where you operate. So that's going to be the case. Other than that, I'll call on you, Emmanuel, and Give to share any last remarks that you have as we come to the end of the session. Emmanuel, any last remarks on your end? Hello?
Yes, sorry, David. I got issues with my connectivity.
It's okay. I'm just saying maybe you can give us any final remarks that you have as we come to the end of the call.
Sorry, is it gift myself? We starting?
Yourself. You can start, Emmanuel.
Okay. All right. Thanks, David. Very much. Of course, I'm actually impressed by the way you do your assessment after the presentation. I think, and the interactive nature of how you then get comments from your members or participants. I think it really something that I find very useful and an eye opener, and I hope we can do that at FAPMA as well. But I think my comments are that the emphasis for collaboration. I think we need to continue to collaborate and partner, and we're working in the same space. We operate in the same space, and we're driven by the same objectives. And as fellow professionals and colleagues working in different areas of practice, I think it's important that we keep on talking to each other, and we assist each other in developing the practice of pharmacy and everything that we do. And it's something that I look forward to. And as a pharmacist, I suppose they're qualified to be members, or don't they? Yeah. Okay. So it's the message I'll take to the FAPMA board and put them, give them a recap of what transpired, and also we also got pharmacist colleagues on the board and also in various companies that I think will be very useful members for APM, and let's work together. We have got a conference and exhibition taking place in Accra, Ghana. It is an annual conference and exhibition that brings together all the manufacturers. I'll confirm the dates. It's November, should be November. I'll confirm the dates, the actual dates. But you are all invited to come and participate We'll be looking at not only pharmaceuticals, but other health products and commodities as well. And so it's an area that there'll be a lot of insightful presentations and discussions touching on the whole landscape of pharmaceutical production and availability of pharmaceutical products in Africa. All right, thank you. Otherwise,
Thank you so much. Thank you.
Yeah, thank you.
Glad to continue engaging, and thank you for honoring our invitation as well to share the work that you're doing and opportunities for us to work together to strengthen the industry together. Really appreciate it. Gift,
Thank you.
over to you.
Thanks, David, and thanks to Mr. Mjuru for such an eloquent outline. I think from our end, this sets the tone of our future interactions. We'll get more feedback from our members. I understand you had a good link for people to share their feedback and questions and recommendations, but we'll also take advantage of our local meetings through our secretariat to get as much feedback as possible, which will then inform how we can adjust the mechanics of these interactions and also critical subject matters that we can consider as high priority as we proceed. But I really appreciate this, David and Tim. And once again, thanks to Mr. Mjuru and all the members who joined us today. Thanks.
Thanks, Gift, for
you so
inviting
much.
me. You're the one who told me about. Thanks, Gift.
Yes.
The pleasure is mine, Mr. Mjuru. Thank you.
Thanks. We'll meet again.
Great, thank you so much. It's been a pleasure working with you, Gift, from the initial conception of the partnership and engaging and working with Pharmaceutical Society of Zimbabwe to the point that we've done this first event. I think it's been an honor working with you and engaging, and wonderful presentation by yourself, Emmanuel, and the experience that you have, the wealth of knowledge, but also the passion that you have for the industry. I believe there's more that we can do together and we can drive growth in the industry. For all the participants who came in, thank you for honoring our invitation, for joining us, for listening in through the end of the session and actually extra time because of the lapses that we've had in terms of time. So I think there is an opportunity for us, and all I can say is let's work together to strengthen the industry, but also use it as an opportunity to power growth for the sector and also the entire region where we need to be. Thank you and have a good evening ahead. And thank you, Juliet, for your collaboration and support on the other side.
Okay.
Thank you and good day.
Good day.